Just take it in for a second. Guilford County commissioners dropping the rule that we have to mask up in public. It feels like this big transformative moment, almost like we're turning a corner. The question is, are we turning towards the light at the end of the tunnel, or is it another twist in the endless maze of coronavirus? I'm Ben Briscoe. From now until 6 o'clock, we're going to dig into where does the pandemic actually stand right now, and what is it going to take to end this thing? To answer those questions, let's start with how we got to the big headline of today. Guilford County commissioners say they dropped the new mask rule because our coronavirus numbers are getting better. They said they needed either 70% vaccination or a 5% positivity rate for 3 weeks straight. Well, we did reach one of those. Here it is. Our 21-day positivity rate dropped below 5%. Here's why that matters. Researchers at Johns Hopkins say the percent positive is a critical measure because it gives us an indication how widespread infection is in the area where the testing is occurring, and whether levels of testing are keeping up with levels of disease transmission. But the CDC, they see things differently. On their website is a section called Your Guide to Mask. You can search by county to see their recommendations. Look at this. As of today, it says we are still in high transmission of the virus. The site says everyone should wear a mask in public indoor spaces. So how do you make sense of those two different views of our coronavirus numbers? Here's how the Guilford County Health Director puts it.
I think that we're in a position where our metrics are moving into the right direction. We're seeing some improvement in our positivity rate, our number of cases. We don't have as many people in the hospitals right now as we had before, but we continue to be in a high level of transmission.
I asked you on my Instagram page, Watchdog Ben Briscoe, should Guilford County get rid of the mask mandate? You can see 64% of people said no. One person asked, if we drop the mask mandate, won't our COVID numbers start going up again? Well, the Guilford County Health Director says it is possible to keep the virus in check without the mask mandate if we all still remember those 3 W's we used to talk about all the time. First, wash your hands. Then we have to wait 6 feet apart in public places. And the last one, wear a mask. The county health director says even if commissioners get rid of the mask rule like they did, unvaccinated people should still keep the mask on.
People that are unvaccinated, that they should definitely continue to wear the mask, even if we don't have a mask mandate. If we continue to move our vaccinations numbers in a right direction, if we're celebrating our holidays, being mindful of all of these things, I think that we can really keep these numbers down.
Another reason to feel optimistic about the pandemic, kids age 5 to 11 can now get vaccinated. That represents almost 900,000 people across our state. In about the 2 weeks since the shots were approved, only 8% of kids in that group have gotten at least 1 dose. But Van says those numbers, they're going to go up since it's still early. However, she says we cannot just focus on the kids. We need more adults to get vaccinated too.
I think that we really need to also consider our vaccination rates in our adult population as well, because we haven't really reached a high number of adults being vaccinated as well. So we can really take both of them in silos, because we all live, work, and play together in our community, both children and adults. So we need to move vaccinations forward for both of these groups in order for us to be able to move out of the pandemic.
But she has seen something encouraging. Parents are starting to get their first doses with their kids.
Being able to get vaccinated with their kids is something that it's really convenient, so you can get it all done at one time. So they may have been waiting for pediatric vaccines to become authorized so they can do it with their children, so they can show that type of support for their kids.
We got to talk about the other vaccine too. Doctors say getting a flu shot can help control the pandemic. COVID hospitalizations have leveled off in recent weeks. However, it's important to note they're still not as low as they were during the summer when numbers looked really good. Today, Cone Health reported 55 people in its hospitals with coronavirus. Doctors feel we could see a twin-demic, with healthcare systems overrun with COVID patients and flu patients, but it's all preventable.
Being hospitalized for the flu the same way as being hospitalized with COVID is putting a huge burden on our medical systems, on our hospitals, filling out those hospital beds, filling out the ICU beds, is preventing the hospital systems for taking care in an efficient way of some of our other more vulnerable members of our society. So making sure that these particular preventable illnesses are being taken care of with vaccinations.
So doctors say we have a long way to go before we reach that light at the end of the tunnel. There's some promising news though. Brandy Smith breaks down what new treatments could help us get there.
Why could new drugs help us turn the corner in the COVID-19 pandemic? When the COVID vaccines rolled out, many people hoped that would be the end of the pandemic. But thanks to vaccine hesitancy and the highly contagious Delta variant, COVID continues to linger. And now we're seeing cases slowly increase in the U.S., mostly in cold weather states where people are now gathering inside. There could be hope on the horizon, though, thanks to pills that could be successful treatments for the virus. To understand why pills are such a big deal, you have to look at the treatments we have right now. One of the most successful, monoclonal antibodies, is given either as an IV infusion or a series of 4 shots done in a medical setting. Research shows it is effective at preventing hospitalization and death, but it must be administered early on in the infection. Now, Merck has submitted data to the FDA showing a pill it developed to fight the flu reduced COVID-19 hospitalizations and deaths by about half. Pfizer also just announced a pill it developed, reducing the risk of hospitalization and death by nearly 90%. Both can be potentially taken at home, reducing the strain on the hospital system. While all this offers hope that the end of the pandemic could be in sight, experts still stress the best way to end it is to get vaccinated. With The Why, I'm Brandy Smith.
So the takeaway from experts is we are moving towards that light at the end of the tunnel. It's just a really long tunnel. We can get there quicker if everyone does their part and follows the advice of medical professionals.